Mr. President, I'm joining my colleagues today to speak in opposition to the Republicans' catastrophic budget bill that will end health care coverage for millions of American families so that President Trump can orchestrate the largest transfer of wealth from the poor and working class to the ultra-rich that we have ever seen in this country. This bill has nearly $1 trillion in health care cuts, including over $800 billion in Medicaid cuts. In total, the nonpartisan Congressional Budget Office estimates that this bill would not only add $2.4 trillion to our national deficit, but it also kicks 16 million Americans off of their health insurance in the next 10 years. In Nevada, that means about 95,271 people will lose their health care. 66,571 will be kicked off of Medicaid. These numbers alone should at least give my Republican colleagues pause, make them think about how devastating this bill would be for our working families, and maybe even reconsider moving forward with trying to ram it through Congress. But there's more to this than just these big numbers, and it needs to be brought to light. I was just home in Nevada meeting with Nevadans, hospitals, providers. With the Medicaid cuts they're anticipating from this billionaire tax giveaway, hospitals are bracing themselves not just for coverage losses, but for the downstream impact on care and costs. This is going to affect our most vulnerable populations in Nevada: seniors, children, veterans, parents of children with rare diseases, pregnant women, and our elderly in nursing homes. When people lose coverage, they delay their care. A single mom who's living paycheck to paycheck and is worried about putting food on the table for her kids is not going to go to the doctor if she has a persistent cough. She will wait. But that means that when her cough turns serious, making it harder for her to breathe, she'll have to go to the emergency room for treatment. By then, it's more dangerous for her and more expensive for everyone involved. The hospital she goes to has to treat her, regardless of whether or not she has health insurance. If she can't pay, the hospital is on the hook for the cost of her care. Now, if you are in a rural or underserved area, of which we have many in Nevada and across the country, and the one hospital for miles can't afford to keep those doors open, it may scale back or close altogether. And the hospital staff have to choose which services to cut: labor and delivery, mental health care, trauma units. These are services entire communities rely on. Or will they be forced to close entirely if they can't make up the costs? In rural Nevada, people sometimes have to drive 2 to 3, 4 hours to see their doctor. A hospital closure would be devastating for rural families trying to access even basic care. That's the danger we are facing with this bill. This isn't just about Medicaid patients. As providers look to cover the cost of treating more uninsured patients, those expenses will shift to everyone, to working families and to employers. Premiums and out-of-pocket costs will soar. Also, that this president and Republicans can pay for tax cuts for billionaires. You know, this is always also going to impact Nevadans who rely on the Affordable Care Act for their medical insurance. Republicans, in their bill, cuts almost $300 billion from the ACA marketplace plans. And that would kick about 29,000 Nevada small business owners, middle-class families, and legal immigrants like dreamers off their health care. It would also increase Medicare premiums for over 1 million seniors, and it could end health care coverage for 1.5 million children. These are real people who are going to lose their coverage as a result of this bill. And this impact would be lasting. This bill is so expensive that it would force Congress to make even more Medicare cuts in the future. For those who don't immediately get kicked off their health insurance as a result of cuts to Medicaid, my Republican colleagues want to implement burdensome work reporting requirements so they can take away coverage from even more Americans to pay for those billionaire tax cuts. In Nevada, over 67% of Medicaid recipients, they're already working. But if this bill passes, those working families will have to jump through even more government reporting hoops to prove that they work. We know this from states that have tried this, like Arkansas, that people lost Medicaid not because they didn't meet the requirement, but because they couldn't keep up with the red tape. Think about this. People working who already have access to Medicaid, they're making it harder for them to get it, which means that then if you lose your Medicaid and your insurance, there's a possibility that because if your health gets worse, you're going to lose your job. We're going backwards. This bill adds complex paperwork, frequent deadlines, and little flexibility to the everyday lives of hardworking mothers, veterans, and families across the country. And why? Again, because the Republicans' goal is to take Medicaid away from as many people as possible so that they can find revenue to pay for the tax cuts for billionaires. Think about what I said at the beginning. It's the biggest shift in our country of wealth from the poor and the working class to the billionaire class. Instead of making the billionaires pay for this, they're taking it off the backs of the very people that are working in this country in the middle class. And they're preventing from the poor from getting into the middle class, and they're making it harder for the middle class. This is absolutely absurd. It is un-American, and we cannot accept this as our new normal. So, my Democratic colleagues and I are going to continue to stand against this outrageous and dangerous bill because we know that the American public deserves better. Americans deserve a Congress that is helping to lift the poor into the middle class and helping the middle class have their lives a little bit easier. And if we're talking about who should pay their fair share, well, I can guarantee you if we polled Americans, they would say it was the billionaire class. The billionaire class should pay their fair share and not make it harder. Not make it harder for the poor and the working class just to get by and just to get through the day. With that, Mr. President, I yield the floor.
Mr. President.
Senator from Wisconsin.
I rise today on behalf of the 228,000 Wisconsinites whose health care is on the chopping block if Republicans get their way. At a time when Wisconsin families are asking us to take on the skyrocketing costs of health care and prescription drugs, congressional Republicans are doing just the opposite. My Republican colleagues are not using their time and energy to go after greedy corporations, not to take on the big drug companies, and not to expand access to affordable health care. But they are instead forging ahead with a bill that will kick millions of Americans off of their insurance and jack up the cost of health care for millions more. I keep hearing my colleagues falsely claim that we are exaggerating how horrible this plan is for working families. They want to pretend these cuts are just going after waste, fraud, and abuse. And I'm not here to engage in a he said, she said about this. The Congressional Budget Office, a nonpartisan analyst, released a new report today and found that the Republican plan will result in 16 million Americans losing their health care. That means that those last-minute changes that were made in the middle of the night in the House resulted in 2 million more people being kicked off their health care. Of those 16 million, nearly 150,000 Wisconsinites will lose their Medicaid coverage. And sadly, it doesn't stop there. This bill is yet another attempt to chip away at the Affordable Care Act. In my state, over 80,000 Wisconsinites will be priced out of their affordable care. And more will see their marketplace coverage costs skyrocket. We are talking about children with disabilities, grandparents, working families, and so many more whose health care is literally right now in jeopardy. I heard from Annette in Kenosha, Wisconsin. She has 3 children, including a 6th grader with severe special needs. She wrote to me about her daughter Maya's first year before they got access to Medicaid. She says, and I quote, "We paid $16,000 out of pocket after insurance for her hospital bills, surgery, and appointments. It destroyed our savings and pushed us to the brink of losing everything. Medicaid is not fraud, waste, or abuse. Medicaid supports kids like Maya who are in desperate need and the families who love them," end quote. She told me that she doesn't plan to stay on Medicaid forever, but that program has been, quote, "a godsend to us right now. It was a rigorous process to qualify. I hope other families like mine will have the support they need to keep their families healthy," end quote. I also heard from Evan in Madison, Wisconsin, who's undergone 2 brain surgeries and subsequent radiation over the last 10 years to treat brain tumors, in part paid for by Medicaid. He wrote to me, and I quote, "I sacrificed a lot to hopefully become a part of the working class. If Trump meddles further with my health care, I won't be able to afford my medication that literally gives me the ability to go out and be a part of my community." Or take Kevin in De Pere, Wisconsin, whose 19-year-old son has Down syndrome and relies on Medicaid for care. Kevin had a message for my colleagues who are considering advancing any cuts to Medicaid. He wrote, "I ask you to remember that Medicaid is not about dollars. It's about dignity, about opportunity, and ensuring that all individuals, regardless of ability, can thrive." For Americans like Kevin and Annette and Evan, Medicaid is a lifeline. Without it, millions of families would forego the care or face almost certain financial ruin. But congressional Republicans are putting all of that on the line, making Americans jump through more hoops and over more red tape to access their life-saving care. And why? To kick enough eligible people off Medicaid to pay for their tax cuts that overwhelmingly benefit corporations and their special interest donors, the very same corporations that jack up the cost of health care on Americans in the first place. And as deep as these cuts are, they fall far short of the total cost of the handouts that the Republicans are proposing in the form of tax cuts for the wealthy and corporations. Their plan won't just kick 16 million Americans off their health insurance or 4 million Americans off of food assistance. The Republicans' plan will also balloon the deficit by $3 trillion over the next decade. While Republicans spend the rest of their summer figuring out how to pass their agenda that puts their campaign donors and corporations ahead of working families, I'll keep raising the alarm bells about the real Wisconsinites whose health and lives are in the balance if they get their way. And I yield the floor.
Mr. President.
Senator from Vermont.
Thank you, Mr. President. I want to join my colleagues in talking about one of the terrible elements of this bill, and that is it's going to take away Medicaid coverage, health care, for this morning, it was 13.7 million people across this country, including Vermont and including Missouri. But we just got an update. It's 16 million people. 16 million people are going to lose health care. And this Medicaid program that provides access to low-income folks, to kids with disabilities, and of course those parents who do so much to care for their child with special needs need that Medicaid to be able to keep body and soul together and give that child that they love the best they can possibly have. It provides health care for 2 out of 3 seniors who are in nursing homes. Medicaid pays for those hospital beds. So how is it that at a time when health care is expensive, it's getting out of reach for more and more people, it is the biggest expense many families face, that we are actually considering in the United States Senate a bill that would take away health care from 16 million people. It's hard to believe that the United States Senate has any degree of appreciation for the reality of the everyday lives of folks who depend on this health care. The legislation also takes away subsidies that have made it affordable for people to buy into the Affordable Care Act, known as Obamacare. It's the margin that is necessary for thousands, millions of people to be able to continue to get health care coverage through the Affordable Care Act. So we literally have a piece of legislation that is going to take away this health care for individuals. It's going to take away health care from families who are getting access through the Affordable Care Act. This bill also is cutting nutrition programs. You know, the SNAP benefits really matter for lower income families. It's how they feed their kids. And in your community and in mine, we have thousands of volunteers who put together food shelves, community food programs. They do Meals on Wheels. They volunteer to do everything they possibly can to help our kids in school with nutrition, to help with the Meals on Wheels for our seniors, and then, of course, to distribute and help with the SNAP program. Millions of Americans are going to lose that. And by the way, that SNAP benefit, it amounts to about $6 a day, maybe a little more. Hardly a big bonanza, but an incredibly important component of keeping body and soul together. It's the meals that are so essential to the well-being, not just of our seniors, but to our children. So all of this is being done as a way of, quote, paying for legislation that is going to lower taxes. And I don't know how it works for you in Missouri, but when I'm talking to Vermonters, nobody has come up to me and said, Peter, you have got to get to work on getting me that tax cut. Nobody believes there's a tax cut in this bill that's going to be anything at all meaningful to them in their struggles with affording paying their bills at the end of each month. Now, if you're in the uber wealthy class, you'll get $250,000. You know, that's real money. Although for some of those folks who are making millions of dollars a year, there won't even be anything they notice. But why is it that we're pushing through this legislation that will provide a tax cut to folks who, by and large, don't need it, will do very little for working class people, will have a negative impact on their ability to pay their bills, especially ones who are going to lose access to Medicaid, especially folks who are going to lose access to the food stamps or the SNAP benefits that are so essential to their well-being. And that's on top of all of those folks having to pay more because of the tariffs. So this is an assault on the budgets of working families in America. That's what it really is. It's going to shrink their take-home pay at the end of the month. That's literally what it is we're doing. And for what? To provide a tax cut that's not going to be meaningful for the vast majority of Americans who really will end up paying more through tariffs and lost access to health care and nutrition programs than they will ever, even in the wildest stretch of imagination, get from the tax cut, the so-called tax cut bill, the big, beautiful bill. But there's another part of this that's so damaging, and especially for those of us from representing rural America. Individuals need health care, but they can't get health care unless they can go to a community hospital, unless they can go to a community health center, unless they can go to a private practitioner who accepts Medicaid reimbursement. All of those people who lose access to Medicaid to pay those bills are going to continue to show up at the doctor's office. They're going to show up at the emergency room. They're going to go to our community hospitals. They're going to go to our community health centers. And those health centers and those doctors will continue to do everything that they can to provide care, even if they don't get paid. But at a certain point, they can't continue. They can't keep the doors open. They can't pay salaries to staff. They can't pay the light bill. So what this does is not only take away access to health care for individuals, it starts to unravel the health care system to deliver health care to people in the community. Those institutions that lose the modest revenue reimbursements that you get from Medicaid, far less than Medicare, far less than private pay, are going to lose that revenue in those institutions, those hospitals, those practices already operating on a very thin margin are going to go out of business. And then what happens? We put all of the pressure for paying for the healthcare system on the private sector. And what we have seen over and over again is the so-called cost shift. It's a real thing. It's not a so-called cost shift. It's real. So the more money you take out of Medicaid, the more money and more burden you put on the private insurance market. And who pays that? A lot of our employers. You know, in Vermont, and I'm sure this is true in Missouri, our employers really care about, our employers care about their employees. And there's a struggle every year for employers who want to provide employer-sponsored health care when they get the sticker shock of a 10, a 15, a 25% increase in premiums. And that always then forces the discussion about, do we want to give a raise or do we want to just maintain benefits but pay for the higher premium with what would have been your raise? So that's further pressure. So this bill does real harm to individuals, but it really also starts to continue to accelerate the unraveling of a financially insecure medical payment system. So why do we do this? It's hard to answer. You know, it's a theoretical benefit that the theory here is if you lower taxes, we're going to boost the economy. We've been hearing that since Reagan, and that's very much in dispute, especially when the lower taxes go to folks who don't need it, and the folks who are struggling to pay their bills aren't getting much relief and are getting higher costs from tariffs and getting higher costs because they're losing access to health care, and where this is going to weaken our communities. And then, of course, finally, what we're going to see is a significant increase in our debt. And the recent CBO scores, I think, put it at $2.8 trillion. And what are we getting for that? You know, sometimes a country has to borrow, like we did in World War II. Sometimes we have to borrow like we did during COVID. Sometimes you have to borrow to rescue the economy, like we did after the 2008 Wall Street crash. And you know why you're doing it. But when you're in better times, where you don't have this market collapse, you don't have this mass pandemic, that is not the time to be adding to the debt. And what it does is it means that in the future, if we do have to borrow for an emergency, our capacity to do it is more limited. And what it is also doing right now is raising interest rates. And as interest rates go up, the cost of debt service on our budget goes up. And right now, the biggest expenditure of taxpayer money is to pay interest on the debt that is escalating exponentially. So we're spending more on debt service than we do on the military. We're spending more on debt service than we do on Medicare, and way more than we are on Medicaid. And by adding to the debt, it's clearly putting pressure on interest rates, raising what it is taxpayers have to pay. So there's nothing good in this bill for the working person or for their small businesses that, when they need to borrow money, are much better off if they can get a lower rate of interest. Or when a family has to get a car loan, they can get a lower rate of interest. Or a mortgage, can they get a lower rate of interest? It's the exact opposite. So we've got families who are paying more because of tariffs, losing a lot because of losing their Medicaid eligibility, and losing their access to the Affordable Care Act, and then everybody paying more because of the high interest associated with the escalation in the debt. Mr. President, we should kill this bill. And I would urge all of my colleagues to take into consideration how this is going to affect the people who each of us represents. You know, there's a bipartisan element to this bill. The bipartisan aspect of this bill is that everybody is going to share the pain of what this bill does. It's folks in a red state, it's the folks in a blue state, whether they voted for, pardon me, Harris or they voted for Trump. They lose their Medicaid, that hurts. They lose their community hospital, that hurts. They pay higher interest rates, that hurts. Mr. President, let's come to our senses and vote against this bill. I yield back.